COVID-19. Posted by Health and PharmaZone. The virus that causes COVID-19 is known as SARS-CoV-2. It appears to have first emerged in Wuhan, China, in late 2019. The outbreak has since spread across China to other countries around the world. By the end of January 2020, the new coronavirus had been declared a public health emergency of international concern by the WHO. The most commonly reported symptoms include a fever, dry cough and tiredness, and in mild cases people may get just a runny nose or a sore throat. In the most severe cases, people with the virus can develop difficulty breathing, and may ultimately experience organ failure. Some cases are fatal. The WHO declared that the official new name for the virus that also formerly went by the names 2019 novel coronavirus or 2019 nCoV is now to be known as SARS-CoV-2, which causes COVID-19. This name change is to differentiate it from other coronavirus outbreaks that include the common cold, but also the severe acute respiratory syndrome, SARS-CoV, and Middle East respiratory syndrome, MERS-CoV, which have previously afflicted the world. What is SARS-CoV-2? Structure and pathogenesis. Human coronavirus origins. Testing. What is coronavirus and COVID-19? Coronaviruses are a large family of viruses. Some cause illness in humans, and others cause illness in animals, such as bats, camels, and civets. Human coronaviruses cause mild illness, such as the common cold. Severe acute respiratory syndrome, SARS, is a viral respiratory illness caused by a coronavirus, called SARS-associated coronavirus, SARS-CoV. Previous coronaviruses have included SARS-CoV and MERS-CoV. Eudiaresis severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, is a new strain of coronavirus that has not been previously identified in humans. Simple outline. SARS-CoV-2 belongs to a large family of coronavirus species commonly in humans and animals. SARS, severe acute respiratory syndrome, 2002. MERS, Middle East respiratory syndrome, 2012. COVID-19, coronavirus infectious disease 2019. SARS-CoV-2, severe acute respiratory syndrome coronavirus 2. Structure and pathogenesis of coronavirus. This virus, it has a series of protein spikes on its surface which when viewed under a microscope appears like a crown. This gave rise its name corona, which is a Latin word for crown, and it's therefore common to all the coronaviruses. Coronaviruses are enveloped viruses, minute in size, 65 to 125 nanometers in diameter, and contain a single-stranded RNA as a nucleic material, size ranging from 26 to 32 kbs in length. There are 4 structural proteins on SARS-CoV virus similar to other coronaviruses: the S and E, and the M and the N proteins. S stands for spike. E stands for envelope. M stands for membrane. N stands for nucleocapsid. This crown-like S or spike protein is responsible for allowing the viruses to attach to the host cell. It consists of a receptor-binding domain which recognizes a specific receptor, the angiotensin-converting enzyme receptor 2, which is expressed in the lungs, heart, kidneys and intestines. It has been shown that this protein binds to ACE2 receptor at least the same affinity and potentially as much as 20 times with greater affinity than the SARS virus. This could be one of the reasons why it is spreading so easily. The spike S protein itself has 2 functional subunits. S1 binds to the host cell receptor and S2 mediates the fusion of viral and cellular membrane, because of critical role that these protein play in binding to target cells and cellular entry. A particular focus is in the design of vaccinations and treatments for COVID-19. These spike proteins are also ever-changing in shape, making the virus to easily hide from antibodies recognition. This diagrammatic representation shows how coronavirus invades the respiratory cells. Human coronavirus origins. The most likely ecological reservoirs for coronaviruses are bats, but it is believed that the virus jumped the species barrier to humans from another intermediate animal host. This intermediate animal host could be a domestic food animal, a wild animal, or a domesticated wild animal, which has been suggested to be a bat and pangolin. In a local seafood market in Wuhan, China during 2019, bats and pangolins are animals that were reported to have transferred the disease to humans. Testing. There are two types of tests. COVID-19 tests are now available to test for current infection or past infection. A viral test tells you if you have a current infection. Two types of viral tests can be used: nucleic acid amplification tests, NATs, and antigen tests. An antibody test, also known as a serology test, might tell you if you had a past infection. Note: antibody tests should not be used to diagnose a current infection. General principles for infection prevention and control to prevent or limit transmission of COVID-19. First, early recognition of patients who have suspected, probable or confirmed COVID-19. Second, physical distancing during COVID-19 outbreak. Third, respiratory hygiene and cough etiquette. Fourth, management of patients with acute respiratory symptoms and/or suspected or proven COVID-19. Fifth, application of standard precautions for all patients at all times. Implement transmission-based precautions based on risk assessment. Thank you so much for watching. Please click the red button. Subscribe, like, share and comment. Keep tuned for more. Thank you.